Namaskar and welcome to News Night. With the rising number of coronavirus cases in India's big cities, we'll be looking at the challenge of COVID management in the big city. So let's begin with the headlines. Prime Minister reviews the COVID-19 situation and preparedness, takes cognizance of the recommendations of the empowered group on requirements of beds and isolation wards in hospitals, instructs Health Ministry officials to put in place emergency plans in consultation with states and union territories, advises the Health Ministry to ensure proper preparedness in view of the monsoons. Union Home Minister Amit Shah to hold two key meetings on corona situation in Delhi on Sunday. Meeting with Union Health Minister, Lieutenant Governor, Chief Minister and AIIMS Director along with SDMA officials in the morning. The Home Minister to hold a second meeting with the mayors of 3 municipal corporations of Delhi at 5 p.m. Health Ministry releases new protocol for COVID-19, loss of smell and taste, muscle pain and diarrhea included in symptoms of coronavirus. Remdesivir and tocilizumab have been recommended for use as treatment. India says that the claims made by Nepal by passing the Constitution Amendment Bill to include parts of Indian territory are not based on historical facts or evidence and is not tenable. Asserts that it's violative of the current understanding to hold talks on outstanding boundary issues. The Army Chief General Manoj Mukund Naravane says that the situation on the Indo-China border is completely peaceful and says that military talks between India and China over the eastern Ladakh have been very fruitful and both armies are disengaging in a phased manner. The Army Chief reviews the passing out parade of the Indian Military Academy in Dehradun and addresses the new officers. Narendra Modi to hold a video conference with state chief ministers and administrators of union territories next Tuesday and Wednesday. This is Prime Minister's first interaction with chief ministers after Unlock 1. COVID-19 active cases are 1,45,779. Recovery rate increases to 49.95%. More than 1,54,000 patients in total have recovered in the last 24 hours. More than 7,000 patients have recovered. The number of government and private laboratories in the country has increased to 885. More than 75 lakh people infected with the coronavirus worldwide and 4,26,000 deaths. US, Brazil and Russia are the most affected countries. The new cases of corona are emerging from China's capital Beijing, and some major markets in Beijing remain closed. Classes in primary schools in the city have been stopped. So let's begin with our top story. Prime Minister Narendra Modi held a detailed meeting with senior ministers and officials to review India's response to the COVID-19 pandemic. The meeting reviewed the national level status and preparation in the context of the pandemic. The meeting also took stock of the situation in different states and union territories, including Delhi. So this meeting was attended by the Home Minister, the Health Minister, the Principal Secretary to the Prime Minister, the Cabinet Secretary as well, the Health Secretary, the DG of ICMR and other related people of the empowered groups. Dr. Vinod Paul, member Niti Aayog, convener of the empowered group of Medical Emergency Management Plan, made a detailed presentation on the current status and the likely scenario of COVID-19 cases in the medium term. So it was observed that out of the total cases, 2/3 are in 5 states with an overwhelming proportion of the cases in big cities. In view of the challenges being faced, particularly in the large cities, it was discussed to augment testing as well as the number of beds and services to be effectively handled to peak surge of the daily cases. Now, the Prime Minister took cognizance of the recommendations of the empowered group on city and district-wise requirements of hospitals' beds, isolation beds, which will be required, and instructed the Health Ministry officials to undertake emergency planning in consultation with the states and union territories. He also advised the ministry to ensure suitable preparations in view of the start of the monsoon season. The Prime Minister suggested that the Home Minister and the Health Minister should convene an emergency meeting with the Lieutenant Governor, the Chief Minister of Delhi, in the presence of all senior officials of the Government of India, Government of Delhi, and officials of municipal corporations of Delhi to plan out a coordinated and comprehensive response to handle the challenge posed by the rising cases of COVID-19. Now, the Union Health Ministry has issued a fresh clinical management protocol for the treatment of COVID-19 patients. The criteria for management of suspected cases, probable cases and positive cases have been defined. For positive cases, management protocol for mild, moderate and serious cases have been spelt out. Directions for children and elderly have been given. Measures to be adopted by hospitals and healthcare centers to prevent the spread of COVID-19 have been laid out. Now, under the new clinical management protocol for COVID-19, remdesivir and tocilizumab have been recommended for treatment. HCQ continues to be repurposed as a repurposed drug. Loss of smell and taste are now officially the symptoms of the infection. Apart from this, fever, cough, fatigue, shortness of breath, expectoration, myalgia, which is muscle pain, rhinorrhea, which is running nose, sore throat, diarrhea and loss of smell or loss of taste preceding the onset of the respiratory symptoms. These have been reported. Now, the new symptoms for COVID include pain in muscle and diarrhea. And coming to the treatment, convalescent plasma treatment will be used if steroids aren't working, and tocilizumab is to be used in patients with moderate disease. Infections and TB should be ruled out first. HCQ to be avoided in patients with severe diseases, but can be used for early onset. ECG has to be done before giving HCQ. Older people and immune-suppressed patients may show atypical symptoms like fatigue, reduced alertness and mobility, diarrhea, loss of appetite, delirium as well, and absence of fever. Now, children might not have reported fever or cough as frequently as adults. So these are some of the observations that have been made. The Union Home Minister Amit Shah will hold two key meetings on the coronavirus situation in Delhi on Sunday. The meeting with the Union Health Minister, Lieutenant Governor, Chief Minister and AIIMS Director along with SDMA officials will take place in the morning, and the Home Minister will hold a second meeting with the mayors of 3 municipal corporations of Delhi at 5 p.m. Here's a look at the situation in the metro cities. The coronavirus cases in India have crossed another grim milestone, 3 lakh mark. But it is noteworthy that 60% of this pandemic are from 10 cities. Taking cognizance of media reports on Friday, the Supreme Court detailed status reports from 4 states, Delhi, Maharashtra, Tamil Nadu and West Bengal, regarding the conditions in hospitals. The data of COVID-19 patients that came on Friday evening was alarming. It showed that 2,000 cases surfaced within 24 hours and the number of infected people reached around 37,000 in Delhi. NCT Government of Delhi has already made it clear that there is a lack of sufficient beds in hospitals. The scene of COVID-19 in Delhi is alarming. The death rate of infected people in the capital has reached around 3%, which is a cause of concern.
ये बहुत चिंताजनक है कि दिल्ली में जिस तरह केसेस बढ़ रहे हैं और लोग परेशान हो रहे हैं, जिसकी वजह से निश्चित रूप से भारतीय जनता पार्टी मानती है कि दिल्ली सरकार से भारी चूक हुई है। टेस्टिंग में बहुत भारी कमी, जबकि एक तरफ केसेस बढ़ रहे हैं और आप टेस्टिंग कम कर रहे हो। दूसरा, ट्रेसिंग, जो कॉन्टैक्ट ट्रेसिंग है वो तो दिल्ली में 0 है। अगर हम पूरे हिंदुस्तान की बात करें तो वहाँ 46% कॉन्टैक्ट ट्रेसिंग कर रहे हैं राज्य, लेकिन दिल्ली में वहीं 2% हो रही है। कंटेनमेंट जोन आपने जो बनाया उनमें एहतियात नहीं बरते गए, वहाँ पर जो रूल्स, जो नियम लागू होने चाहिए वो सही से नहीं हुए। इलाज की अगर हम बात करें तो सरकारी अस्पतालों में बद इंतजामी के हाल हैं, वहाँ लोगों को इलाज नहीं मिल रहा है।
3 लाख का आंकड़ा पार कर गया है और पहली बार सबसे ज़्यादा 11,000 से ज़्यादा एक दिन में 24 घंटे में वो केसेज आए हैं। लगभग 9,000 का आंकड़ा छू रहा है जिसमें लोगों की मौत हुई है। तो ये वास्तव में चिंता की बात है।
After the Delhi government got a flag from the Supreme Court, it was up to the Delhi LG to take the matters in its hand, and that's one of the reasons why Delhi LG Anil Bajal formed a committee, a 6-member committee with prominent members, including Director General of ICMR and Director of AIMS, Randeep Guleria. Idea of this committee is to make sure that there are 2-3 points that they are working on. The first is to break the chain of transmission. Also, they are working on a way to reduce the mortality rate, which is quite high in Delhi. The second and important part is to provide infrastructure. Remember, according to Delhi government's own admission, by the end of this month, by the end of June, 15,000 beds would be required to treat patients suffering from COVID-19.
In view of the increasing cases of COVID-19 in Delhi, the Home Minister Amit Shah has convened a high-level meeting at 11 o'clock on Sunday. The Union Health Minister, Dr. Harshvardhan, Delhi Lieutenant Governor Anil Bajal, Chief Minister Arvind Kejriwal and officials of the MHA will attend this meeting. It is noteworthy that Chief Minister Arvind Kejriwal had called on Union Home Minister Amit Shah on the situations in Delhi. Moreover, Delhi Lieutenant Governor Anil Bajal constituted a high-level committee to suggest steps to deal with COVID-19 crisis. Meanwhile, the Supreme Court and the Delhi High Court have directed the NCT government of Delhi and the central government to increase beds and ventilators in hospitals for COVID-19 patients. Earlier, Delhi government had informed the High Court that till June 9, there were 9,179 beds for COVID-19 patients in the city, out of which 4,914 were occupied and the remaining were available. The Delhi government also told the High Court that a total of 569 ventilators were available, out of which 315 were being utilized and the remaining are available. Maharashtra is the only state besides Delhi where the rate of coronavirus infection is so high. In Maharashtra, the rate of new positive cases has reached 20.1%, and more than 1 lakh cases have come to light only in Maharashtra. 3,500 COVID-19 cases surfaced in Maharashtra alone on Friday. In Mumbai, there are more than 55,000 COVID-19 cases. In COVID-19 infection, Maharashtra is on the top in the country. Tamil Nadu is in the second position, where coronavirus infection cases have crossed 40,500 mark. A record number of new cases surfaced there on Friday. Within 24 hours, 1,982 COVID-19 cases came to light in the state. Around 350 people have lost their lives due to COVID-19 infection in Tamil Nadu. Among the new cases in the state, 1,477 are from Chennai. After these cases, the total number of infected people in Chennai has reached around 29,000. Taking this into account, Tamil Nadu government has launched 173 ambulances and mobile rapid medical units, which will help in the fight against the disease in 15 localities of Chennai. In West Bengal, more than 10,000 people are infected by COVID-19, and 451 have lost their lives due to the disease. The capital, Kolkata, is the worst affected place in the state, where more than 3,500 people have been infected. Although the number of active cases is 1,750 only, but 283 people have died in Kolkata alone. Now, the number of infected people is increasing in Hooghly district. 682 people have been found positive there, and more than half of them are migrant laborers. After focusing on the big cities in the fight against COVID-19, now it's the time to focus on small and medium towns and cities. Bureau Report, DD India. So let's take a look at what the situation is like in the major cities of our country. Let's begin with Delhi to start with. So, well, the infections are spreading at an increasingly fast pace in Delhi, and that's a matter of concern. So the situation is the total number of cases, as we can see, 36,824. The number of recovered patients is 13,398. The number of deaths is 1,214. So we can put that into context. And moving on to our next slide, 2,137 cases have been reported in the last 24 hours. That's what we are concerned about. Around 9,000 tests in 40 labs in Delhi per day. So that's what's being conducted. There are about 242 containment zones spread across Delhi, and it's not in certain places, it's right across Delhi. So the total of 9,647 COVID-specific beds have been identified in Delhi, and 5,402 beds are occupied as per the official reports, but 4,245 beds are listed as vacant. So that doesn't look too bad as we look at the numbers. 601 is the total number of ventilators that are available in Delhi, and 552 are in use. 352 are in use. 249, therefore, are vacant. So that looks like a pretty decent situation, under control in a sense. But that's not quite the case, it appears. Union Ministers Amit Shah and Dr. Harshvardhan will be meeting Delhi's Lieutenant Governor and Chief Minister on Sunday to review the COVID situation. This is an important meeting that's going to take place tomorrow. The SDMA members, AIMS Director and senior officials will be attending this meeting as well. The Lieutenant Governor Anil Bajal had constituted a 6-member high-level panel and a committee that's going to give suggestions. The DG-ICMR 2 members of the NDMA, AIMS Director, the DDG of the DGDH was also there. That was the members of the committee. Now, looking at the what do they suggest? They are looking at converting stadiums and Pragati Maidan into temporary hospitals if necessary. The Supreme Court had expressed serious concern over the condition of Delhi's hospitals as well. That was a matter of concern. The Supreme Court has raised questions on COVID care, disposal of dead bodies, and the lack of testing. These are some of the concerns that they have made. Now we'll move on to Mumbai. The financial capital accounts for half of the total of Maharashtra's cases. Over 55,000 cases, in fact, in Mumbai. Mumbai is the most COVID-infected city in the country, more than Delhi as well. The total cases, 55,451, so concerns there in the big city. 25,152 people have recovered. That's a good sign, but not quite half the number of people who are infected. 28,000, the deaths therefore are 2,044, the deaths in Mumbai alone. There's a total of 1,094 ICU beds in Mumbai, and many of them, 1,083 have been occupied. So it's full, chock-a-block in Mumbai. 464 ventilators in Mumbai, out of which 437 are in use. 93% of Mumbai's isolation beds are also full. So Mumbai is chock-a-block in a sense. Now 2.9 lakh isolation beds in the state of Maharashtra, that's all across the state of Maharashtra. 9,000 ICU beds, 3,500 ventilators in Maharashtra. So that's across the state. Mumbai police personnel have been infected in sizable numbers. That's one of the concerns that the state is facing. The corona warriors are getting infected. Total positive cases in Maharashtra is more than 1 lakh. Let's look at Chennai now. 28,924 cases reported in Chennai. And the cases are increasing there. That's a matter of concern. 70% of Tamil Nadu's total cases are in Chennai. So Chennai is a matter of concern that way. 14,723 people have recovered, which is also a good sign. And 294 people have died. That's the situation in Chennai. 40,698 cases have been reported so far in the whole state of Tamil Nadu. The state government has regulated charges for corona treatment. That's a good thing because they can't, the private sector can't charge too much. And corona treatment is included in the state health plan as well. So it looks in control in Tamil Nadu as far as the government is concerned. They're regulating the prices. Now, total cases in Kolkata are 3,356. That is in Kolkata, yes. The total recoveries are 1,323. We're talking about Kolkata. The deaths are 283. So we've covered the 4 metro cities here, and 1,750 active cases in Kolkata. The 69 COVID hospitals are in West Bengal. We're talking about the whole state, out of which they have 8,785 beds, 920 ICU beds in the state of West Bengal. The governor has expressed some concern about the way bodies are being disposed of in the state. That's one of the concerns in Kolkata. So the corona status across India now. Well, let's take a look at the total cases, 308,993. That's right across our country. And 60% of the cases are from 10 cities. We've named 4 of the main cities for you. 60% of the cases are from 10 cities. So very much urban-centric. The rise from 2 lakhs to 3 lakhs has taken place in 10 days. So we've moved from 2 lakhs to 3 lakhs in just 10 days. 11,458 cases were reported in the last 24 hours. And 49.9% is the recovery rate, which is increasing. We're going to take a short break, and we'll put all this into perspective with our guests who will be joining us via satellite link. Stay with us.
काश मैं महंगी टिकिया ले पाती।
महंगी नहीं, फेना सुपर वॉश टिकिया आजमाइए।
बेहतरीन झाग, रोज और चंदन, सुपर चमक।
महंगी टिकिया जैसी धुलाई फेना सुपर वॉश टिकिया में समाई।
फेना ही लेना।
फेना कपड़ों से हटाए कीटाणु, इंडिया में बना गर्व के साथ।
पहला अक्षर रट लो तो वह से एक विद्वान होगा। पक्की होगी बुनियादें तो हाँ से हिंदुस्तान होगा। पहले करो शुरुआत करो, करो तो पक्की बात करो।
वंडर सीमेंट, एक परफेक्ट शुरुआत।
So in focus discussion tonight is this. Tackling COVID in densely populated areas is what we're going to be discussing in focus tonight. Tackling COVID in densely populated areas. Joining us via Skype is Professor Vijay Raghavan, the Principal Scientific Advisor to the Government of India. And on Zoom, we have Dr. Anant Mohan, who is the HOD, the Department of Pulmonary Medicine at the All India Institute of Medical Sciences. Thank you very much, gentlemen. Professor Vijay Raghavan, so the situation is really one of COVID management in the big city. And we are beginning to find this challenging at the current time because the numbers are increasing rapidly. Of course, steps have been taken. But, you know, what would you say? I mean, do we require more from people for this to be successful?
Well, this pandemic is such that we require more from every section of society in a focused manner, depending on which area we're talking about. You refer to densely populated areas,
yes,
and
yes.
What's important over there is we need to have effective social distancing, and that begins with rigorous use of masks. People should wear masks on their face, cover their face, particularly when they're speaking in company, and not wear them on their chin. Social distancing to the extent possible in crowded areas is necessary, but masks really play an important role, as does hand washing. And it's important that we equip crowded areas where people share toilets and baths with foot-operated water sources and hand washing devices. These are all feasible. These have been promoted by government agencies, including our office, and this needs to be amplified. If we do these 2 things, which are in our hands, we will curb the spread enormously. There are 2 other things, contact tracing and testing, and that contact tracing is very important, manual and digital contact tracing, so that anyone who has symptoms needs to be traced to those others they were in contact with who may be pre-symptomatic, and therefore need to also be isolated. And testing is important. Testing sometimes can take a while because of access, but while that is being awaited, people should isolate themselves. People with mild symptoms should stay isolated so that they don't affect others. People who are in contact with others who don't yet have symptoms should also isolate themselves. So these are all in our hands.
Indeed, but Professor Raghavan, as far as testing is concerned, I mean, we are still, you know, we are not looking at the antibody tests being used widely by the public. That would be much more easy for people to start, you know, to see whether they have the virus or have had the virus in the past. That would give us a little more clarity as to where the virus is. Is there a chance, you know, that that's going to be increased over time?
So there are broadly two kinds of tests. Those which detect the presence of the virus, that is typically the standard RT-PCR test.
The RT-PCR test.
But there's another test in that category which is coming up, which will test the presence of the virus in a new way. It's called the antigen test. And once that rolls out with high specificity and sensitivity, that will be useful. So we are looking forward to that coming out soon, both in India and internationally. So that's the first category of tests. The second category of tests, the antibody test, tells you whether you've been exposed to the virus or not. And that's useful, but that is a very different kinds of test from that identifying the virus presence.
Okay, but no, I mean, from my cursory reading of the subject, it appears that the antibody test will, can be done much more easily. It's a simple blood test, and it's an ELISA test, which you do for other antibodies which are already available. So, I mean, in that regard, people are already aware of the kind of antibodies that they have, in a sense, and that they can gauge their own, behavior as a result of that.
As of now, the antibody test, including the ELISA test, which is much more sensitive and specific than the other so-called rapid tests, they are very useful in looking at population level prevalence. They are not yet ready to be rolled out as individual tests, which will require both a dramatic lowering in cost of the ELISA test, but also an increase in sensitivity and specificity. But seroprevalence, the prevalence of immunity or exposure rather in the population, is very valuable, particularly in crowded areas. And the ICMR has conducted a study whose results will be out very soon. They reported on the results in multiple districts, and I expect they will soon report on what the results are for crowded areas and containment zones.
Right. Let's bring in Dr. Anant Mohan into the discussion. So, Dr. Anant Mohan, there have been a few more things that have been added as symptoms. One is loss of taste and smell, that, and also diarrhea. Rhinorrhea was also there, already running nose. So, and as far as the treatment is concerned, tocilizumab has been allowed in moderate cases. So, how would you view all these, the new guidelines?
Yeah, so, okay, so if we go to the clinical features, the symptomatology and the management part, yes, although the majority of the cases do present with very non-specific type of symptoms, as you know, it is the mostly upper respiratory symptoms, and that includes rhinorrhea, sore throat, fever, headaches, myalgia, body aches. And to some extent, the features of pneumonia. The features of pneumonia may be the cough, dry cough, and in some cases, when it becomes moderate or severe, it will become the patients may start becoming more breathless, short of breath, start breathing more heavily, and their oxygen saturation level then starts to dip down, and that is when they will need support, oxygen support, and hospitalization to a more aggressive extent. And of course, now with more and more cases, one is getting to see more and more different presentations also. The extrapulmonary presentations, for example, you mentioned the gastrointestinal symptoms, the diarrheas is one relatively common one that we see. Okay. Of course, loss of taste, loss of smell is also one. So we are getting to see a variable presentation now, and as more and more cases increase, we'll get to see them. The severe parts are the ones which are a cause of worry. They are the ones that progress to sepsis, severe infection, sepsis, septic shock, and the ARDS, that is the adult respiratory distress syndrome.
But,
these are the ones.
Right, but Dr. Mohan, the number of beds that are required now, because the cases are increasing, we've seen them, across the country move from 2 lakhs to 3 lakhs in just 10 days. Are we geared up, in a sense, for this kind of rapid rise, especially in the big cities?
Well, one is trying to be, because to keep up the pace with the cases which are rising so fast. And again, to re-emphasize that 80 to 85% of the cases remain mild, and they recover on their own without any significant management, any treatment, symptomatic management only. So probably it is those 10 to 15% of the cases who really require more intensive monitoring, proper hospitalization, oxygen, and out of that, around 5 to 7% may ultimately go on to require intensive care support. So the need of intensive care ICU beds and the ventilators will depend upon this fraction of the total number of cases that we have. So that has to be calculated accordingly, keeping in view the future and keeping in view the likely pace at which the number of cases are likely to rise. So that is what we have to keep pace with.
Right. Dr. Vijay Raghavan, the number of cases, the large number of mild and asymptomatic cases is probably a good thing because these people can look after themselves. But, you know, the basic requirements such as vitamin C and some of the medication that should be easily available, some people are reporting that they are in short supply, especially in the big cities. So how does one deal with a situation like this? Because you require at least that much to deal with this virus.
Well, I think there are multiple levels, as Dr. Mohan pointed out, of symptoms. At the simpler level, where symptoms are mild, healthy diets of any kind, and there are diverse choices available depending on the context, are sufficient, and one doesn't have to take supplements. It's only when medication of various other kinds are needed for fever, for other symptoms, that access becomes very important. This is a good time for us to look at ways by which one can broaden that access. We have been discussing for a significant period of time how telemedicine and e-pharmacies need to operate. And in many ways, a lack of access in one location means access in another location, and ways by which, even for the poorest people, such access can be notified and medicines delivered would be very valuable. The government is considering these kinds of programs where access can be amplified in each of our areas of strong spread of disease right now, such as Mumbai and Delhi. And I'm sure that, for example, the task force which is set up by the Lieutenant Governor in Delhi will address this well.
Right, and with regard to ramping up the number of beds, Professor Vijay Raghavan, the plans of using stadiums as well as let's say Delhi at Pragati Maidan, but similar kind of recommendations could be made for Mumbai or for other big cities, and let's say the best practices that are prevalent, if they are successful in these big cities, can be replicated in some of the smaller cities where the cases are actually now beginning to increase there as well. So are we setting models in place, in a sense, is what I'm asking?
Well, I will leave it to people on the ground, the members of the Lieutenant Governor's task force, for example, and others, to ask the specifics about specific locations. But you're absolutely right. Even before the increase in places like Delhi and Mumbai, we have learned a lot from the growth of the disease in India and elsewhere all over the world. That's allowed our management to become much improved and much better. And in many ways, this has resulted in the reduction in the number of fatalities and the extent of the morbidities and decisions about who should be at home and who should come to hospital. These combined learning lessons put in specific context into districts where different kinds of systems and boundary conditions operate will be very valuable, and that's already being done. The National Disaster Management Authority, the Health Ministry are both working with state governments right down to the district level to ensure that this is being done.
Right, Dr. Anant Mohan, largely because, the big city is huge and infrastructure, though it has been ramped up, may be tested. It's advised that many people can actually be at home and look after themselves in home isolation. What sort of a personal kit should they have, in home isolation for them to take care of themselves?
Well, first of all, when they are told to go into home isolation, they have to be, first of all, the emphasis of the very basic principle that we keep talking about, the social distancing, the hand hygiene, the cuff etiquettes. These are the three things that must be re-emphasized, again and again hammered in. Apart from that, just simple measures again at home, measurements about some warning signs. For example, we can tell them to monitor their own symptoms. We can tell them if they're having fever, they can monitor their fever, maybe maintain a temperature chart. They have to maintain their own symptom chart kind of thing. If they feel any worsening of the cough, worsening of the breathlessness, then they can be, if possible, they have a small oxygen saturation probe with them, a finger probe, the small instrument which can be very easily, the saturation of oxygen can be measured by keeping it on the finger. So these can be advised to them and they can monitor them at home at regular intervals. Although it has a downside. Sometimes it may lead to a kind of a hyper reaction in terms of patients sometimes to do this. They may be doing this hundreds of times a day. So that is also something we do not want. But these are the warning signs remain: increase in the symptoms, increase in breathing difficulty, worse breathing difficulty, or fast breathing, and drop in oxygen saturation. These seem to be the simplest warning signs when they should immediately come. Of course, any other signs of any untoward incident or any untoward symptoms which are not present earlier, then they should immediately report back.
Okay, a final word from you, Professor Vijay Raghavan. You know, there are 160 vaccines that are, currently being looked into, and the WHO is also on the job. How soon are we likely to have a vaccine? Because only then, can life get back to normal? Otherwise, this new normal is 50% of your time you're worried about how to dodge the virus, and you can't concentrate on your work.
I fully understand the anxiety and the anticipation and the wait for a vaccine. And that is perfectly reasonable and normal. But we must keep in mind that vaccine development is an extraordinarily complex process which requires animal trials, early human trials, mid-stage human trials, late-stage human trials, and regulatory approval. Typically, this takes 10 years and several $100 million. The world is now trying to do it in 1 year for a few $1 billion. And this is being done by parallel processing, which has multiple stages at the same time, and manufacturing and stockpiling even before vaccines are approved in anticipation. So far, some vaccines have gone well. 2 are in global phase 3 trials, which is late trials prior to approval. So I think there's a good chance, if all goes well, that we will have a vaccine by the end of the year. But keep in mind that having a vaccine is one step. Having it stockpiled and filled and finished and ready for distribution, deciding who to distribute, who gets it first, who gets it next, is a big, big, complex challenge. And that will also, and this is an unusual vaccine because it has to go to several billion people in the world and not just children as most vaccines. So it will take time, it will happen, but we must in the meanwhile do our bit absolutely thoroughly so that we reduce the burden of disease.
Thank you very much, Professor Vijay Raghavan and Dr. Anant Mohan, for being with us. So the important thing there is that it will happen, is what Professor Vijay Raghavan says. Moving on to our next story then. The Indian Military Academy in Dehradun held a passing out parade today for its 146 regular course and 129 technical graduate courses. And this was the year's first passing out parade, which saw 333 Indian and 90 gentlemen cadets from 9 foreign countries becoming Army officers. The Army Chief General Manoj Mukund Naravane reviewed the parade. However, the high point of the event was when General Naravane commented about China, and he said that India's borders with China are under control. He expressed the hope as well that through the continued dialogue, all perceived differences will be set to rest. Here's a report. As many as 333 officers joined the Indian Army on Saturday after the passing out parade at the Indian Military Academy in Dehradun. Wearing a face mask, Army Chief General M.M. Naravane reviewed the passing out parade of 423 officers, including 90 gentlemen cadets from 9 friendly foreign countries. However, amidst the differences with China over the LAC, the Army Chief General Manoj Mukund Naravane said that the situation along India's borders with China is under control, and the ongoing series of high delegation-level talks with the Chinese side has been followed up with meetings at the local level between the commanders of equivalent ranks. The Indo-China face-off has been on for more than a month now. On Friday, Indian and Chinese army delegations led by Major General-ranked officers held discussions in eastern Ladakh again to resolve the standoff between the border troops. This was the 5th round of meetings between the 2 major generals to break the stalemate that began with a violent confrontation between rival patrols near Pangong So on the night of May 5th and 6th.
Entire situation along our borders with China is under control. We are having a series of talks. It started with the Corps Commander level talks on the 6th of this month. This has been followed up by a number of meetings at the local level between commanders of equivalent ranks. And as a result of this, a lot of disengagement has taken place. And we are hopeful that through this continued dialogue that we are having, all perceived differences that we have will be set to rest. As I said right at the beginning, everything is under control. Both sides are disengaging in a phased manner. We have started from the north, from the area of the Galwan River, where a lot of disengagement has happened. It has been a very fruitful dialogue that we have had.
The Army Chief reviewed the cadets who were graduating. General Naravane said that the cadets are being commissioned as officers into the Army under the most daunting of circumstances, and these high standards of their military training will help them in overcoming the challenges lying in store for them.
It is not the end, but the beginning. As you step across the Antim Pag and enter the portals of Chetwood, remember what lies ahead of you is the Pehla Kadam of your life as a commissioned officer of the Indian Army. It is a proud and momentous occasion for the entire nation that 333 gentlemen cadets are joining our glorious army today. I also take this opportunity to convey my felicitations to the 90 gentlemen cadets from friendly foreign countries for successfully completing your training. I am certain that you will do your countries proud.
The ceremony, which symbolizes the transformation of a gentleman cadet into a young officer, is being held every 6 months for the cadets, who then go on to join different arms of the services of the Indian Army. The foreign cadets go on to join their armies in their respective countries. However, due to the coronavirus outbreak, for the first time, guardians of the cadets were not invited in order to avoid crowding. With these young cadets passing out, they expressed their heartiest happiness. One such cadet said that although their training was halted due to the current coronavirus pandemic, they still remain hopeful.
In beginning, it was a little hurtful, but now I would say it is good for all. It's for a greater cause. Due to this COVID situation, our training halted for a little bit, but we kept continuing all the initial things which we had to do. And finally, it's good that we are passing out on time.
The passing out parade is one of the best-known traditions of the IMA, which consists of military bands and other displays of synchronization discipline. It marks the completion of the course by the Indian Army. In the end, the passing out also consists of traditions such as the presentation of a Sword of Honor. Notable recipients of the Sword of Honor include the current Chief of Defence Staff, General Bipin Rawat, and the Olympian and former Union Minister, Colonel Rajavardhan Singh Rathore. Sudhir Yadav's report, DD News. Well, India on Saturday reacted sharply to Nepal Parliament's move to alter its map unilaterally. It dismissed the move by Nepal to redraw the map without consultation with India. The Ministry of External Affairs said that the claims made by Nepal by passing the Constitution Amendment Bill to include parts of Indian territory is not based on historical facts or evidence and is not tenable. Taking a stern view of the move, India asserted that Nepal's action violates the current understanding between India and Nepal to hold talks on outstanding boundary issues. The lower house of Nepal's parliament on Saturday passed the second Constitution Amendment Bill to redraw its map, guaranteeing legal status for the new updated political map of Nepal, which includes Indian territories in Pithoragarh district of Uttarakhand. And for more on this, we are joined by our correspondent Amritpal Singh, who is joining us with an update. And to put it into perspective and context, we have with us Ambassador Manjeet Puri, former ambassador to Nepal. We'll begin with you, Ambassador, in fact, because this situation, I mean, Nepal, the army chief had said that Nepal was acting at the behest, perhaps, of someone else. What would you say?
Look, I can't comment on what the Indian Army chief has said, but let me make this upfront to you. Nepal is a country where the issue of nationalism is invariably linked with a kind of anti-India sentiment. Now, this particular issue came up at a particular time in Nepal's politics where there was a great deal of uncertainty regarding the seat of government, the Prime Minister. This was an old issue which was raked up. They have now released an updated map. It has gone through one of the most significant processes, that too in a special sitting of the House of Representatives on Saturday, which is a holiday here in Nepal. And look, what is being done is to, in a sense, make this whole thing kind of a line in stone. And that's what makes the thing very untenable. It should have been avoided at all costs. And considering especially the very strong and diverse ties between India and Nepal in all facets of life, and particularly among our people.
Right, but Ambassador Puri, also, I mean, the concern was that Nepal has is with this 80-kilometer road, apparently. But surely, you know, they must have been aware that this road was being constructed earlier itself. You know, on the day of the inauguration, they can't suddenly decide that, you know, this is a matter of concern.
I have no doubt that they would have known that the road was being constructed. In fact, let's understand that this is a path which we have used for years for the Kailash Mansarovar Yatris to go from India, cross over into Tibet. So the use of the path was known. We've metalled that path. They obviously must have known about it. And they must have also been preparing the map. But the timing, etc., has much to do with Nepal's domestic politics. It has much to do with what else is happening. And I'm sure some kind of encouragement would have certainly come from other quarters in the matter. But of course, I have no evidence to support that. The issue that I mentioned to you about domestic politics is very much alive in Nepal. But the important thing is that this huge relationship which binds India and Nepal, especially at the level of the people, it's a relationship which is a sacred relationship. It's a relationship which really helps Nepal. It helps India. It's a relationship which is time tested. It has geography and history on its side. And we should be very mindful of doing anything on that. And I really do believe that this is untenable and this should not have been done by the Nepalese side. And in fact, the process is still going to go on. But a very significant step in that process has already been completed today.
Right, indeed. And Amrit, you can tell us about, you know, what is the next step then, because India has reacted, and how is this going to play out? Also, this road that is being constructed is going to be useful for the Kailash Mansarovar Yatra, which is, you know, which sees a large number of people every year wanting to participate in it.
Okay, Mark, first what happens next is that now that the lower house of the Nepal parliament has passed this new map by a voice vote in which 258 members unanimously passed this out of the 275, that means they have a 2/3 majority. It now goes to the upper house, the National Assembly, and it has 72 hours to pass it. Now, you know, if they pass it, and which looks like that they would, because all political parties in Nepal have lent support to it, the matter could escalate because India has reacted rather sharply to it. India has been telling Nepal that, you know, all outstanding issues that on the border question that exist can be resolved through talks. And there is a foreign secretary level mechanism for it as well. Remember when Prime Minister Modi had visited Nepal, and before that, then in 2014, August, and in July, the then Foreign Minister, External Affairs Minister, Sushma Swaraj had visited. So the foreign ministers had put, and the prime ministers had also agreed that the foreign secretaries should talk and resolve this at the earliest. In the latest move, when Nepal had come up with this map, India had told Nepal that, you know, let the pandemic get over, let communities and governments respond to it, and we are open to talks. We can talk this out. Nepal is a friendly country, as Ambassador Puri says, and, you know, India has always been open to the issue, resolving the issue. So Nepal is basically trying to paint itself into a corner by taking this escalatory move. But with the way forward, as India has always suggested, has been talks, because the two countries have people-to-people contact, a friendly relationship. As far as the road goes, as Ambassador Puri said, that the road has always existed. I mean, there has been a path that has
Yes,
existed.
it's
Now
been
what has
nettled.
been done is the defense minister on May 8th inaugurated a motorable road, and pilgrims have been using that road. Trade has been happening between India and China. There are various treaties that exist.
Okay.
Nepal, if it cites certain treaties of 1816, India is open to discussing all that, and
Okay.
India has consistently maintained that position that talks are the
Yes,
only way.
Amrit.
So clearly, this is an escalatory move, which is sort of unfortunate, and which, as
Okay.
Ambassador hints at, could do
Yes, Amrit. And I'm
more.
afraid that's all the time we have for in this discussion. So I'd like to thank both Ambassador Manjeet Puri as well as Amrit Pal for those updates and crucial updates and context of those updates as well. Moving on to our next story in an exclusive conversation with DD News, the ICMR's head of epidemiology, Dr. Ganga Khedkar, spoke to us about the new symptoms identified for COVID-19 under the clinical management protocol that has been released. Let's listen to what he said.
Dr. Ganga Khedkar, the new medical protocol has come for COVID-19. Tell us about what are the new symptoms that have been added.
There are two symptoms which we have added. One is loss of taste and other one is loss of smell as a sensation. These two sensations are likely to be lost if you have COVID-19 infection. So they have been added to the list of different symptoms like fever, cough, breathlessness, which we already have in the list.
What is the guidance for HCQ? Does the protocol say that an ECG needs to be conducted of every patient before HCQ can be administered?
True. See, hydroxychloroquine can affect one's heart if it is already diseased. Then in those cases, it is possible that they may develop a cardiac problem which could potentially be fatal, and therefore every patient who is going to be started on hydroxychloroquine must undergo ECG as a test at least once.
What does the protocol say on convalescent plasma therapy? Because I understand the trials are still underway of the therapy.
Convalescent plasma therapy is generally given as a supportive care to any patient who is severely sick. However, here it is believed that when you take convalescent plasma means you are taking the plasma or a part of blood from patients who have already had COVID-19 infection. So they have developed weapons against that COVID-19 which are called as antibodies, and if I provide those antibodies through this plasma to an individual, then in that case he may improve. So convalescent plasma, though we are conducting a large trial which is halfway through as of now, can be provided to people as supportive therapy on compassionate ground. You take consent of such a person, explain to him about convalescent plasma, and then provide to them as a treatment modality. The sites which are participating in clinical trial, which is led by ICMR, they are expected to give data which is collected after providing this plasma, and which will be analyzed, and we will be in a position to tell whether it helps or not.
What is the guidance for children and elderly in the new protocol?
See, this protocol tells you that the risk of death tends to be high among those who are older people, those who have diabetes, hypertension or other chronic diseases, those who are pregnant women, and those who could be children below the age of 10 years. Now, these people should be isolated. They should not mix with people who will move out of their houses because the lockdown has been lifted as of now. They should take usual precautions of safe distancing, use mask even at home, and they must ensure that they will go for hand wash, and cough etiquette should be strictly followed. The two populations that we mentioned, we still don't have an evidence to say that the mortality rates or death rates will be high among children and pregnant women, but still as a precaution, assuming that their immune systems are weak, we have put them in this population.
In what stage is India in terms of transmission of COVID-19?
I think more than stage, you have to believe in one thing, that the infection continues to increase in India and in significant numbers. It is not unexpected because people are moving out of their houses and they are coming in contact with others. Perhaps we need to believe that if the lockdown has been lifted, one needs to think that every individual has currently become a frontline worker to save themselves from acquiring this particular infection. They must follow all precautions that are advocated. Frontline workers are not only doctors or healthcare providers, but for prevention purposes, every individual who walks out must believe that he is a frontline worker and he will prevent acquisition of infection.
Well, on the one hand, we are seeing that over 60% cases are in 15 cities. On the other hand, we are also seeing more infections in newer places or in remote areas, Ladakh and Sikkim, for instance. What are the challenges going forward?
The biggest challenge that to my mind that exists is if you actually look at the pattern of infection, it's very high in metropolitan cities, and in metropolitan cities it is high in pockets where population density is very high. We need to ensure that we devise a strategy whereby those who are infected and close contacts actually will be in a position to assume safe distancing in addition to use of mask by being located from that population dense place to some other locality so that they will be able to maintain safe distance and no longer transmit it to others.
Well, moving on to our next story then. Delhi's Lieutenant Governor Anil Baijal on Saturday approved the changes in Delhi's epidemic diseases regulations, which empowers officers of the health department, district magistrates as well as SDMs, authorized health officials and sub-inspector and above of the Delhi police to impose a fine of 500 rupees for the first offence and a fine of 1,000 rupees for a repeat offence if any person is found violating them. Observation of quarantine rules. As per the regulation, these are the main points on which the fines can be imposed. Maintaining of social distancing, wearing of face mask or cover in all public places and workplaces, prohibition of spitting in public places, prohibition on consumption of pan, gutka, tobacco, etc. in public places. In case of failure to pay spot penalty, action under Section 188 of the IPC shall be taken against the offender by the authorized police officer. The objective is to make sure that guidelines for containing the spread of COVID are followed strictly in letter and in spirit. The Union Petroleum Minister Dharmendra Pradhan met the Assam Chief Minister Sarbanand Sonowal and discussed the Bhagjan incident. So Sonowal and Pradhan they made a joint visit to Bhagjan on the 14th of June. They will make one on the 14th of June. They discussed the fire incident that took place at the gas well of Indian Oil Limited on June 9. Sonowal demanded maximum compensation for the affected families. The Union Minister will take stock on the site, and the Union Minister during the interaction also took stock of support rendered by the state government and stressed on working on a war footing to cap the well. He also assured that his ministry is closely monitoring the situation and has assured all necessary help. 12 relief camps have been set up by the district administration where altogether 7,000 people are taking shelter. Mrs. Surinder Kaur, a former senior officer of the Indian Information Service and the wife of the former CBI director late Joginder Singh, has passed away after a brief illness on Saturday. She worked in different capacities in various media units in the Ministry of Information and Broadcasting. Mrs. Kaur had served as the head of the Publications Division and DAVP. A strict disciplinarian, Surinder Kaur was an exemplary Indian Information Service officer who was equipped with both skills and empathy. During her tenure in DAVP, she brought about several changes for the betterment of the office. And the Secretary in the Ministry of Information and Broadcasting, Amit Shah, has condoled the passing away of the retired senior IAS officer Surinder Kaur. In his condolence message to the bereaved family, Shah said that Mrs. Kaur was known for improving the working of media units in the context of government communication. Her contribution towards training of information service officers will always be remembered. Her passing away is a huge loss to the IIS fraternity. Now, India's foreign exchange reserves have surged by a massive $8.22 billion to cross the $500 billion mark for the first time. The reserves rose to $501.7 billion for the week ended the 5th of June. It's helped by a whopping rise in foreign currency assets. In a press release, the RBI has informed that the foreign currency assets, a major part of the overall reserves, rose by $8.42 billion to $463.63 billion. In the previous week, the reserves had advanced by $3.44 billion to end at $493.48 billion. The total value of gold reserves, however, continued to decline. Gold reserves declined by $329 million to end at $32.352 billion. India's special drawing rights with the International Monetary Fund went up by $10 million to $1.44 billion, while the country's reserve position also rose by $120 million to $4.28 billion. And that's all we have in News Night for tonight. Thanks for being with us. Namaskar.